Welcome, welcome, welcome. Welcome, everyone. Glad to see so many or see so many familiar names. We'll see faces soon. Welcome, 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 everybody. We will get started in just a minute or so, just giving another moment for people to join. Um, and we'll say this a few times, but to save time, we're not going to have introductions for everyone. But if folks could just introduce themselves in the chat, that would be wonderful. All right. Again, welcome, welcome. We can get started. We can temporarily put the take the slides off. Um, but welcome, 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 everyone. Good to see everybody from across the country. Really excited to be with you all today. For everyone, my name is David Mohammed with the National Institute for Criminal Justice Reform, and we're excited to bring this pretty extraordinary group of folks to you in conjunction with the University of Pennsylvania today. So again, thank you and welcome. I'm going to just briefly give some just opening remarks and welcome and turn it over to the extraordinary team we have here. First, you have come to a discussion around how to identify, and we're also going to talk about, a bit about effective intervention. Although just to how to identify is a significant subject that I think there's a lot of interest in the country. There's a little bit, I would say, controversy around how do we identify populations that are at heightened risk of being a victim or a suspect in a shooting incident. And the great thing is that's a very small number of people in any given jurisdiction, a lot smaller than the general public believes it is. The challenging thing is it's not the easiest thing to do to kind of specify, pinpoint that population to effectively serve. And so just a couple of points of introduction. One, really excited for this discussion. Thank you all for the introductions that are flying in the chat. Good to see people from all over the country, friends and colleagues, and people we may not know. It's exciting to have this discussion. Second, we've asked some friends to join us for this discussion, friends and colleagues. We are just really lucky to have some extraordinary friends in this field that are doing incredible work. So much so we feel like we're getting together a lot, both in person and virtual. I'll just end my introduction with a quick story. When I was the chief probation officer in Alameda County, where Oakland, California is, we were close to having to renew a contract with a risk assessment tool provider. And I was really skeptical of how effective the risk tools were, or more um, accurately, how we were using them. And a probation officer came to me who was, not in favor of the reforms that we were implementing, and said, the problem, and he was a part of something called a task force. So it was a small group of the hundreds of probation officers. There were only 7 that were armed at that time in the department, and they were focused on a task force and focused supposedly on the highest risk individuals. And he came to me and said, I've got 2 people on my caseload. One is a 20-something-year-old who's in a gang, who I'm very concerned about, who's going to be involved in a shooting. He's known to carry guns. He said it to me in different words. Another person, he said, I have this other person who's 45 years old. He is homeless and he's addicted to substances. And they both scored the same on the risk instrument. And I was like, well, that's a problem. And so that week, it was good timing. That week, I had a call with the risk instrument provider, the developer of the risk instrument. And they said, yeah, that's right. They both have the same likelihood to recidivate. And I said, you know what? You're right. One's going to steal from the store. One might shoot someone. I'd like to know the difference. And traditional correctional risk assessments, which have gotten better in their accuracy, are much more about likelihood to recidivate, not the severity of that recidivism. They don't distinguish between stealing from the store and shooting someone. And I think that what we and our colleagues around the country have come to over the past many years is a process, working on an actual tool, but a process that is effective in identifying individuals who are at high risk to be involved in gun violence. So that is the subject today. We can put the slides back up. Many of you all have seen, but we want to share with you again a recent report that Dr. Mikaela Rabinowitz, who is the Director of Data and Research at NICJR, Shantay Jackson, who today is the day before her last day in office at NICJR as the Director of the National Office of Violence Prevention Network. But don't worry, we're not going to let her leave entirely. And Vaughn Crandall, who is a longtime friend and colleague. Oh, before I do that, sorry, let me just pause on this slide and say that's a QR code for anybody younger than me knows what to do with that. But that gets you access to this report. It's also on the NICJR website, but I think an excellent piece on how to identify high-risk populations in depth. And so which just strongly encourage. I know many of you have been able to read it. Also, for those who are less technologically inclined, Isabel has just put a link to the report in the chat as well, whichever way you can get it. But this is what we're going to discuss today. We can go to the next slide. So welcome introductions. I just did that. So lastly, this is the team for today. I want to get out of their way now, but really excited to have this extraordinary group of folks. I talked about Dr. Rabinowitz and Shantay. Vaughn Crandall, who is it says Director of Technical Assistance. He's having some technical issues, but he should be on very soon. Having some internet challenges, which is interesting because I also did this morning, so I understand. And then Dr. and Chief Holly Joshi, who's also doing this work for a long time. She looks a lot younger than her experience in this field. And she is the chief of the Department of Violence Prevention in Oakland, doing an extraordinary job, particularly around this subject of focusing. Sometimes she gets heat for this, but focusing on the very highest risk. Like, nope, this is who we're focused on. We're not focused on car break-in people, although, some of the city want her to focus on that and homelessness and everything else, but talking about, yep, we are focused on the highest risk. Also, our good friend and colleague, Deion Sumpter, the Deputy Director of Violence Prevention Initiatives in Philadelphia, who for a long time was the director specifically of the gun violence intervention and was so excellent in that. They had to promote him in Philadelphia, but also looking at how do we focus intensive interventions at those folks who are at the highest risk of being involved in gun violence, those folks who are group gang involved. And so we got a great, incredible group of folks. I am going to hand it off to my sister, to my colleague, and even though she's trying to abandon me at the end of this week, she will never be able to do that. Will forever be my sister and colleague. I'll turn it over to Shantay Jackson.
Thank you, David. I now have witnesses associated with what feels like stalker level conversations about not letting me lead the team. Good morning and good afternoon, everybody. I'm Shantay Jackson with the National Offices of Violence Prevention Network at NICJR. As David mentioned before, We are really excited to be here with you all today. We've been prepping for months now with regard to being able to deliver this webinar and really interested in your thoughts and your questions as they come. Really good to see a lot of familiar names in the list of attendees and also some new ones. Today for us is really going to be, as David shared, about grounding us in something that we talk about a lot in the field, but we don't always operationalize very well. And that is who's actually driving violence and how do we respond to those drivers of violence with intentionality, right? Um, Want to share that this is not just going to be a research conversation. We don't think that that is going to get us what we really need to get to. This is going to be a conversation about how we align policy and practice and people so that we're focusing our time and our energy on the folks that really matter and the work that really matters as it relates to risk. So you're going to see us during this conversation move in between research and real world practice because both are going to be necessary if we're serious about reducing violence in our communities. Before we jump in, though, I want to quickly take a beat to ground us on how we're going to spend our time together. So we're going to spend about the first 60 minutes walking through the content and the discussion itself. As I mentioned before, we'll go back and forth between Mikaela and Vaughn sharing some research related information with us. And then we'll pick Holly's and Deion's brains about what it looks like practically on the ground. What does this translate into? So as we go along, I want you all to feel free to drop your questions or any reflections that you have in the chat. We don't want you to feel like you have to wait to the end. We'd rather see those come in as you're experiencing them throughout the webinar, and we'll circle back to them. We'll hold about 20-25 minutes at the end of this discussion for Q&A so that we can really dig into how to connect what you're hearing from folks on the panel today to your work on the ground. I'll close before we jump in by just saying that our goal is not simply about sharing information with you all. It's not just about sharing this report. It's about making sure that it's useful to you, that it's actionable, that you know how to do something with it as you're identifying and working with those who are at the highest risk. So let's jump in. Next slide. All right. So before we get into any definitions or frameworks, I think we need to start with a simple question. What are the actions that are really going to produce the outcomes that we say we want? This is something that David talks to partners about across the country all the time. Because if we're honest, if we're having some real table talk with you all right now, a lot of our systems aren't designed to touch the right people at the right risk levels. In fact, a lot of our systems are still designed to touch all the people all the time, and as many people as possible instead of the right people at the right time. So a public health approach is one that really asks us to do something different. It asks us to focus on risk and those at the highest risk. And that's where we see a lot of jurisdictions struggle. And not struggle conceptually, like folks get the concept, but struggle operationally. How are we going to operationalize this? So, Mikaela, as you jump into the next slides, can you talk to us about why risk matters and how it's connected to a public health approach?
Thanks, Shantay. So, as Shantay mentioned, this is a phrase that gets used a lot, the idea that the recognition that gun violence is a public health issue and we need to take a public health approach to violence has become much more widely recognized. And I think it's something that those of us working in the field hear and say all the time. However, when people hear and say that phrase, they often mean two totally different and in some ways contradictory things about public health. So one element of a public health approach to violence is addressing the underlying conditions that give rise to violence, the social determinants of health and the social determinants of violence. And as Shantay said, that really is a universal approach. That is a public health approach to violence. However, it is not the public health approach to violence that gave rise to community violence intervention as an approach and as a field. And so within the field of community violence intervention, taking a public health approach to violence means recognizing that violence spreads like a disease, like an illness. So thinking about the pandemic that we all recently had experience with, understanding that the most effective way to stop the immediate spread of COVID was to identify who had COVID and make sure that those people were quarantining for the duration of their contagiousness. Identifying those people at greatest risk for transmitting the illness and reducing the likelihood that they would transmit the illness to those around them. And that is the same public health approach that applies in the field of community violence intervention. The goal is to understand people who are actively involved in violence and are thus at the greatest risk for spreading violence to those around them, and to intervene with those people specifically. And so that is a critical piece of taking a public health approach to violence and really speaks to why risk matters. So another key piece to recognizing this is in contradiction to the universal approach, this is an extremely targeted approach. Both Shantay and David already mentioned the number of people who are at very high risk for involvement in violence is very small. And through a series of processes that we'll talk about throughout today, those people, for the most part, can be identified, and through that identification, outreach and intervention can happen.
Thanks, Mikaela. So, y'all, what Mikaela just walked through, I think, is critically important because at the end of the day, it helps us to understand that violence is highly concentrated. We're not talking about large portions of a city. Usually we're talking about a very small number of people that are driving an overwhelming share of the harm. But research only takes us so far. So Holly and Deion, I want to pull you all in here. Holly, I'm going to come to you first. So from your perspective in Oakland, how do you actually apply this idea of risk in practice? And why does it matter, right, for how you structure your work?
Thank you, Shantay, Mikaela, and David, and welcome everyone in this morning or this afternoon. So I'm in Oakland, so this is our slide that I use regularly. The 250 to 350 people is the marker that I discuss almost on a daily basis. So the idea of risk in practice has informed everything at the Department of Violence Prevention since 2024. The very beginning of 2024 is when we made some significant pivots based on work that we did with Vaughn and David. A problem analysis, we'll be talking about that a little bit more later, but really the idea of risk in practice and focusing on this very small population of 250 to 350 people has informed everything that we do at the DVP since 2024. I mean, the structure of the department had to change. We restructured the department, our hiring practices, the trainings that we expose our staff to, the program model, program design, maybe most importantly, our partnerships. And that includes our community-based organizational contracts. Just got beat up for my recommendations around our community-based organization contracts last night. I survived. I might need a bodyguard moving through Oakland at this point, but those are very challenging pivots to make within a system that has seen risk and violence prevention and intervention as being the 20,000 people that are criminal justice involved, right? And so it's a very different equation to be trying to serve 20,000 people, including reentry populations and at-risk youth who may be dipping their toe into gang and group violence. Like that, it's a very different conversation, a very different strategy and tactical approach. And so trying to pivot essentially a whole city to get focused around this 250 to 350 people is not for the faint of heart. But so for us, it has informed everything: our structure, our hiring processes, our trainings, our program model, our partnerships, and who, we're giving money and contracts out to. And then most probably, I don't want to leave this off, probably most important to this particular part of the conversation is our intelligence capacity. Like, how are we able to identify those individuals? It has to start there. So if we don't have the ability, the intelligence that's coming from multiple directions to make sure that we can identify those individuals, and we don't have a starting point.
Appreciate that, Holly. Ties very well into the story that David told us at the beginning between, the likelihood of recidivism for the person that was dealing with substance use disorder and the person that was likely to commit a level of gun violence when you think about that criminal justice system population, and us not needing to lump everyone into the same risk categories. So thanks for that. Deion, want to come to you now. Would love to hear the same thing from you on your perspective in Philadelphia. How does this show up in like your real decision making on the ground, risk, and why it matters?
No, thank you so much. And a lot of Holly's sentiments are shared within the city of Philadelphia. And similar to David's comments during the introduction, we've seen within the city of Philadelphia, similar to Oakland, Baltimore, and other cities, only less than 1% of our population has been connected to a large share of some of the violence that we've had within the city of brotherly love. And in Philadelphia, most people that we have identified are connected to violent groups or social networks, involved in ongoing conflicts, and have often even experienced violence themselves. So that allows us to really put a real intentional focus and our efforts on that small number of people who are most likely to be impacted by gun violence. And I think for me, I really want to highlight the point as to why it matters. Like, having that number has really allowed us to be more effective, right? So if we only know less than 1% of the population is linked to a large share of the shootings within the city of Philadelphia, that allows us to really be intentional with that small group of individuals that didn't allow us to have a larger impact. It also allows us to use our resources very efficiently, right? Philadelphia is one of the poorest big cities in the city of Philadelphia, so our taxpayer dollars, we want to make sure that we're utilizing the money that is coming via City Hall, via our mayor and city council, that we're using it in the right means, in the right places as well. And for us to ensure that we're using it within the right particular population has been very beneficial for us as well. And then closing, it just really helps us to help potential victims and also address cycles of violence as well, right? A lot of our individuals that kind of fit that 1% have been or have experienced violence in the past. And since high-risk individuals have already experienced violence or have been a victim or a perpetrator, providing that support can interrupt patterns of retaliation and repeated harm as well. So for us, it has been very beneficial and has allowed us within the city of Philadelphia to see the reductions, because for the first time, we stopped, we listened, we slowed down, and we've been very more intentional on who that population that we wish to target, engage, and which resources we wish to allocate. So it has been very helpful for us within the city of Philadelphia, and our findings are very similar to what we see on the slideshow for Oakland, California.
Thank you. Mikaela, let's stay here on this slide for a second, if we could, because I want us to stay grounded in the practice that Holly and Deion just talked about, because they talked about how they're connecting that public health approach that you referenced before to risk. And one of the biggest gaps that we tend to see is that research and practice aren't necessarily having conversations with each other on the ground to make sure that the supports are happening the way they need to. Deion, I want to come to you and then to you, Holly, before we turn it over to Vaughn. Deion, who are the folks that you feel like you're seeing most at risk in Philly right now? Like, what are the patterns that you're seeing?
And I know Mikaela mentioned like the social determinants of health, and I'm a social worker, right? So with me, my focus, I want to help everyone. But when we think of violence prevention within this public health framework, we understand that it is a small population, and those individuals tend to kind of make up a very unique background and component. And within Philadelphia, again, the city of brotherly love, our focus is on identifying individuals who face the higher risk of becoming involved in gun violence. And what we are seeing is this consists of individuals who are associated with groups who are directly tied or in opposition with another group. These are individuals who are connected through a social network of individuals, 3 to 5 individuals who are engaged in violent activity. And for us, we have paid close attention to these particular individuals who are participating in conflict and also associated with rival groups. The streets within the city of Philadelphia has changed, Shantay. In 2018, drill music that really derived from Chicago really became a prefix of a lot of the conflict that Philadelphia chose to adopt. And we really started to use drill music and social media as a means to antagonize a rival group. So once we saw that the dynamics of group dynamics, street dynamics within the city of Philadelphia changed, we knew that we really need to kind of make a pivot as well. So for us, once we really started seeing these constant emerging groups and social networks throughout the pandemic formalize and change, and we start seeing blocks merge, we really started to really assess some of our risk factors and those that we really wish to kind of focus on within the city of Philadelphia as well. So those group dynamics and those social networks have really played a key role in us being able to identify individuals that we wish to target within that 1% as well. And again, social media anecdotally has also played a large role as well. We're seeing a lot of individuals who choose to use social media as a means of expression, but it's also an opportunity for them to be able to antagonize another group, post a snapshot as to where they can be found. Oftentimes, we'll have a rival group choose to take a snapshot on social media and tell another group like, hey, I'm on your corner, or this is where I potentially shot your brother. So along with the group and social network dynamic that we didn't do through our group audit, we also review social media as a means to kind of help us to identify who we wish to engage and who we wish to target.
Yeah, I appreciate those observations and you really playing forward what the evolution of violence has looked like, right? It really clearly showed that you've been given some thought to the patterns that are emerging in violence over time in Philly. Holly, what about you? What are you seeing in Oakland?
Thank you, Shantay. I absolutely want to echo and lift up everything Deion said. We're definitely seeing very similar patterns in Oakland. One of the things that we really try to do in Oakland is focus on understanding who is most at risk of drawing or driving gun violence within the next 90 days. So we put time around it, right? We're focus is very time bound. And so we're thinking about violence in the immediacy. I think that's another important layer to add here is when we're talking about who's most at risk, we're not talking about 6 months from now, a year from now, 5 years from now. We're talking about within the immediacy. So the immediacy as we define it is the 90 days. And, continuing to run with Mikaela's example of, violence as a public health issue and using the COVID pandemic, we think about who's most at risk in the next 90 days around the idea of proximity to violence. So clearly, if you've been shot or been shot at recently, that's like having COVID. You already have it. You're already afflicted. And then the next thing that we did during the pandemic, right, is like as we worked our way out of the concentric circles, it was like who has COVID and then who's been exposed. So it would be the very same thing with this gun violence risk for us in Oakland, which is if you've already been shot or shot at, clearly you are highest risk. And then the next, kind of rung would be who is there, who is exposed, who's around it. To Deion's point, who's talking about it on social media? Like those folks are most oftentimes connected. Who's rapping about it? Who do we know that you ride with? Who's your crew? Who's your group? So, those are all the questions that we ask. Definitely in terms of identification, what we're seeing is that population is much older than the public thinks, for sure. Of course, juveniles always go viral and people are always have an emotional response to young people and kids being involved in any type of violence, as we should, as the protectors of society. But when you look at the data around shootings and homicides in Oakland, it tends to trend higher and older. We're talking about like late 20s to early 30s, justice involved, like heavily justice involved, not just a few touches here and there. And then as Deion said, group ties. And as I was just saying, proximity to violence for sure.
Yeah. Thanks for that. I particularly like the way you talked about the patterns in a concentric circle kind of layout that connected back to the public health approach to violence. Before we turn it over to Vaughn, there's something that you say all the time, Holly, that I think is worth bringing to this audience because we often talk about perpetrators and or victims of violence. I have been particularly fond of how you frame this in a very trauma-informed way when you talk about the drawers and the drivers of violence, and just wanted to elevate that again for folks who are looking to have, alternative language around that. But Vaughn, coming to you, I mean, what we heard Holly and Deion talk about lines up with what research is telling us. Can you walk us through what we've seen?
Yes, absolutely. And good morning, good afternoon to everyone and to all the partners at NICJR and Oakland and Philly. So we're hearing from two leaders in two very different cities, right? Two different locations, different sizes, different histories and dynamics, but you hear a very common picture. And the picture that Holly and Deanna are painting for us about the dynamics around risk and the population that they're working to engage is very consistently supported by research over the last 30 years across many American cities and some Latin American cities. And we're talking about a combination of problem analyses, which we'll talk more about in a second, which have been done in upwards of 100 major American cities over the last 30 years, impact evaluations of violence intervention and violence reduction strategies, studies on trauma ward entry for people who've been violently injured and shot and who come back to hospital trauma wards, as well as research into social networks. And all of these things align around this shared picture across cities and over time, which is the idea that it's a very small number of people who are directly involved in fatal and non-fatal shootings as victims and suspects. And in general, it's somewhere between 1/4% of a city's overall population. That those folks, as both Holly and Dion illustrated, are older than commonly believed across American cities. The average age of a homicide victim or suspect is in their early 30s, and the average age of a non-fatal shooting or suspect or victim is in the late 20s. That the majority of folks involved in shootings and homicides are known to the criminal legal system. And for folks who are known, they tend to average a lot of prior arrests, usually between 8 to 12 prior arrests per person for a variety of different kinds of charges. And as both Dion and Holly said, a very significant portion of folks have already survived a non-fatal shooting at the time of the shooting or homicide incident. Um, and the other important dynamic that I think both are highlighting is the reality that this small number of justice involved adults who are themselves victims of violence are connected to each other through identity social networks, and that the risk dynamics and retaliation dynamics tend to flow through those networks. And so this is just has continued to emerge as a pretty universal picture across American cities, backed by a variety of different kinds of research that just seems to indicate that this is the population at highest risk of violence. And so if we want to intervene in an effective way, this is really who we need to center.
Yeah, thanks for that, Vaughn. I feel like what we just heard from you reinforces something that's really important for the field and something that I feel like we know, but we can't state enough. We can't overstate, right? That violence isn't random and it's not widespread, right? It's concentrated, it's predictable, it's a small number of people who are connected through these social networks that we talk about being at the center of this. And quite frankly, if we don't design the strategies around the realities that you just talked about, we're going to keep missing the mark.
Absolutely. Shantay, just to respond to one question that was in the chat, which is a question about variation across city size, it is just to say that these dynamics don't really seem to change much, whether you're in cities of 50,000 people or over 1 million people. The question there is really about overall numbers of people impacted, and there can be some difference in terms of rates, but the concentration, the age range, justice involvement, connections to high-risk social networks really does seem to be pretty universal across American cities of different sizes and resource levels and community dynamics.
Got it. Thanks for that. And appreciate you jumping in on that question. Know that you also connected in a little later. Our moderator is going to be moving all of the questions into the Q&A so that we've got them centrally located toward the end here. But always happy to have y'all call an audible if you see something that is relevant in the moment. Mikaela, can you hit next slide for me, please? Or Isabel, whoever's doing next slides. Thank you. So I want to come back to Holly and Deion here because now the question really becomes how do we actually identify the population in real actionable ways and not just in a report and not just retroactively looking at history, but in ways that inform your day-to-day decisions, right? So Holly, let's start with you this time. What steps did you take? And you alluded to this a couple of beats ago. What steps did you take to really understand who your highest risk population is in Oakland? And talk to us about what you had to build or change in your systems to get there.
Yeah, absolutely. Thank you. So first and foremost, I touched on it briefly, but first and foremost, we did a problem analysis. And so we didn't do it, but we commissioned it. Thank you, David and Vaughn. And I think it was really important. It wasn't the first problem analysis that the city of Oakland had ever done. We'd done a few over the years and past decade. But the last one we had done was stale. Of course, the leadership changes happen fairly rapidly, particularly in the city of Oakland. So new mayors, new city administrators, new council members, et cetera. And so really having a problem analysis that tells us exactly what we've been talking about. Like number one, what is the root cause of most violence and most shootings in Oakland? And, it is that gang group, street crew connections really are still important. Because again, urban legend, urban myth sometimes will tell a different story and people say, oh, gangs and groups are dead or gangs and groups never came to Oakland because we've never had Bloods and Crips. We don't look like LA or St. Louis or, certain areas. We do still have street crews, of course, and neighborhood-based groups. So first, establishing the problem analysis so that we can challenge the narrative that had been built up over, about 5 years that included that juveniles were running things and all of that. So we started with the problem analysis. And then as I was hinting at, we had to really focus on what does our working relationship need to look like with our community-based organizations? What does our working relationship need to look like with law enforcement? And I know that can be a very controversial question, and everyone has to decide in their own cities what that looks like. And I know that a lot of it is going to be driven by your own law enforcement agencies and how they're operating. There's various, levels of 21st century law enforcement going on, and some law enforcement agencies are pretty hard to work with. In Oakland, our law enforcement agency has had a consent decree pushing them towards, constitutional policing for a very long time and alternatives to traditional law enforcement strategies. So we decided that our approach was going to be that we would have a professional understanding with our law enforcement and that we would establish a relationship that includes one-way communication. So we go into a meeting every week that the mayor's office runs, and we do shooting review. In that shooting review, we get to hear law enforcement's analysis of every shooting and homicide that happened that week. We don't give them any information. If we know someone that they're bringing up, we don't say, oh, that person's on caseload or anything. We just get the information. And the reason that information is important is oftentimes it gives us a starting point. It also tells us, that because law enforcement data and law enforcement beliefs drive investigations. It's going to drive a punitive response. So if they believe XYZ group or gang is involved, then we know that's the group gang they're going to be focused on. We know that if some of our clients or participants are members of that group or are from that neighborhood, like there's going to be increased surveillance, et cetera. So it's one way to, number one, try and keep your clients safe and healthy and to help them prevent recidivism. They shouldn't be running around with guns at any time, but they definitely shouldn't be running around with guns at this time, right? But maybe even more importantly is making sure that we come together as a team after the shooting review. And first of all, the shooting review is only myself, my deputy director, Daniela Medina, and one other person from my team. We don't expose the direct practice team, the people that are in the field, to the law enforcement shooting review. And then once we leave there with their analysis and their information, we come together as a Department of Violence Prevention team to really check the law enforcement intelligence against what we believe is the most important intelligence, which is what does the community believe? So our violence interrupters and street outreach teams are out there every day, and they're hearing what the community believes that shooting stemmed from. And so if law enforcement is information is going to drive investigations, the community information and community beliefs is going to drive retaliatory behavior. So we have a system set up in which we're able to really gather both. So we again, intelligence-based, making sure that intelligence comes from everywhere, the law enforcement analysis, the community data, which includes social media and rap and everything that Deion was talking about. So I think like that's the most important things about our approach to making sure that we know what's going on. Of course, part of our work with the community data is us consistently updating our conflict maps. Like, so we have this very crazy looking conflict map that shows us which neighborhoods and groups and crews are connected, which ones are feuding. Now, because crime is so regional, it includes other cities and how they're grouped up with, historical groups and gangs in Oakland. To do that and to stay accurate with that, Daniela has to work with Stockton and San Francisco and Antioch. We're working with partners across the state, essentially, to really make sure that we're understanding how our traditional groups in Oakland are now grouped up or feuding with groups from across the region.
Thanks for that, Holly. Deion, talk to us about what y'all did to build or like change systems to get to really understanding what your highest risk population is.
No,
and not just historically, right? But today.
No, absolutely, and I'll tell you historically what we did didn't work, right? So I think what we're doing today has allowed us. We try to forget about the past in Philadelphia, but I know for us, what we've been able to do is kind of go grand and then create a system that allows us to kind of have a daily, weekly flow. So the grand scheme for us and our approach has been very similar to what Holly, Oakland, and other cities have been doing as well. So we've done a formalized program analysis, and we've used different tools to kind of help us reach our goals. Like first, we look at where shootings are happening and identify hotspots throughout the city of Philadelphia. I have to really credit our Philadelphia Police Department because they have helped identify pinpoint grids where shootings are more prevalent, which then allow us to kind of know what communities, what areas, what zip codes we need to allocate some of our resources and really kind of conduct a clear cut canvas and engagement for groups and high-risk offenders as well. After that, we then review each shooting incident to better understand who's involved, who are the players, and whether there are any connections or patterns. We also look at the demographic information and one's judgment involvement, which kind of helps me and helps my team to identify any existing risk factors. And I know some cities use a social network analysis. In Philadelphia, we conduct quarterly group audits, which helps us to understand, how are these groups connected, who are the players, who may be involved. It allows us to track these active groups, the conflict, social media posts, YouTube videos, and also relationships as well. And we really rely heavily, not just on our intelligence bureau, which is a Double Valley Intelligence Center in Philadelphia, but our district captains and also their district analysts that all work in tandem that then allow us to kind of connect the dots of who we're servicing as well. And once we're able to kind of put all the information together, it gives me a much clearer picture of who's at the highest risk and where we should focus our efforts. And as obviously we can't do group audits every day, right? So as we kind of do those quarterly audits, we really kind of commit to some of our weekly meetings. Similar to Holly's point, in Philadelphia, we're able to do shooting reviews with the Philadelphia Police Department. And as Holly represents Oakland, I'm the one that represents Philadelphia on those shooting reviews as we meet with PPD, where they're able to discuss each shooting incident, each shooting victim that may have occurred that previous week. And on that call, we're able to discuss one's connection, the cause, and the possibility of retaliation. And from then on, they're then able to lean on me, share that information, and we can kind of discuss next steps as well. Followed by that meeting, we have our community-based meeting with our street outreach workers. We know what police is telling us, but what's the word of mouth that's taking place within the community? Because oftentimes the investigation may receive some information, but our outreach teams are out in the field. They're out there in real time. They're able to engage victim and perpetrator. They're then able to kind of share some information that police may not have had that can be very beneficial for our engagement strategy as well, which is then followed by our weekly group violence meeting where we're able to just continue to discuss merging groups, merging networks, recent crime trends and patterns, what high-risk offenders or group members are expected to be released from custody, who's antagonizing who, right? So what it all does in this particular ecosystem is allow us to be very intentional with where we're deployed for our GVI. Those weekly meetings allow us to know, like, okay, this is where we need to do our customer notifications for this particular weekend. For our outreach team, these are the areas that we may need to pay a little bit more attention to as well. And we already have the system, all of the listed high risk group members and offenders. But what the weekly meetings does is, oftentimes, people are being released each and every single day. Individuals are choosing, we like to say, jump off the porch in formal terms. They want to kind of, make a name for themselves as well.
Yeah.
And police may not have information on some of the younger folks who are now joining and merging into these particular groups. So we really use the intelligence of our caseworkers, our outreach team that could then bring that information back, and we're able to share the information with our law enforcement partners to let them know, like, hey, these are some individuals, these are some unvetted groups or unvetted networks that we really need to consider, because social media and discussions within our street corners are telling us otherwise, that they are involved and they can be a cause of concern in the near future or for present day as well. So the ecosystem that we've built in Philadelphia has allowed us to be efficient, to be effective, and we kind of look forward to continue to work with Vaughn and company to kind of continue to build additional systems throughout the city of Philadelphia.
Interesting. Thanks for that, Deion. Mikaela, I think that what we're hearing from both Holly and Deion is why it's important to make sure that we've got structured approaches to this work. Can you spend a few minutes talking about what a problem analysis actually looks like for our audience and why we believe it's the foundation to the work?
Yeah, absolutely. So a problem analysis, similar to everything we've been talking about today, also really does come from taking a public health approach to violence. And part of that is making sure that you have a thorough and accurate understanding of the problem that you are trying to solve before you start developing strategies to try to solve that problem. And so problem analysis is a series of analyses, analytic approaches, data collection to really document and understand the specific local nature of gun violence in the place that you are trying to prevent or reduce that violence. So understanding very specifically, and Deion talked about street corners and micro locations, very specifically, where is violence happening? So using GIS mapping and other geographical analyses to really pinpoint the very small number of locations within a given jurisdiction where the majority of violence is happening, or where at least a disproportionate amount of violence is happening. Looking specifically at shooting incidents that have occurred in a given jurisdiction over usually a 2-year period. So actually going and looking at every individual shooting incident to understand what were the circumstances that gave rise to that shooting incident, to ensure that any kind of intervention that you are designing or implementing is tailored to that specific circumstance. So what percentage of shootings in a given location are tied to domestic violence incidents? What percent of shooting incidents are tied to gang or group conflict or social media conflict? What percent of shooting incidents are tied to robberies or other kinds of things? But to really be able to hone in on the specific local drivers of shootings in the place you're doing it. Similar to that, and I think really tied to a lot of what we've been talking about so far around understanding the people who are at risk for involvement in violence, is doing an analysis of people who have been involved in shooting incidents, both as victims and as suspects, over a very recent period of time. So understanding demographically who is involved in violence, and how does that compare to what may be the media perception or the political perception around who's involved in violence. And then also looking at the criminal histories of people who are involved in violence, similarly to make sure that the outreach and the intervention is appropriately targeted towards people who have the kind of prior histories and the kinds of trajectories as people who have been and are involved in violence. And then finally, the last two really speak also to some of the gang and group dynamics that Deion and Holly have spoken about. So understanding the social networks of individuals who are involved in violence, who are the people who they are connected to, because we know that people who are connected to others who are involved in violence are themselves more likely to become involved in violence. And so really doing a deep analysis into those social networks. And then finally, the groups. And that's part of what, again, Deion and Holly have spoken about extensively, but understanding what is the nature of group conflict in the city or in the jurisdiction or in the location or community that you're working in, and how did those conflicts immediately drive violence and also increase the likelihood that someone could become a victim of retaliatory violence, and being able to use that information to do outreach and intervention and prevent the loss of life due to retaliation and conflict.
Yeah. Thanks for this. I appreciate the in-depth explanation of what it looks like to step through a problem analysis with jurisdictions and why it's so important. Specifically a reference about, taking a look at fatals, non-fatals over the prior 2-year period. But want to come back to Holly and Deion here too. Deion, I'm going to come to you first this time because, and we talked about this a little bit, but would love to spend some more time on it. While the problem analysis is obviously given us a historical view, you all have talked about your group audits, you've talked about other things that are coming out of your shooting reviews. Talk to us about the signals or the data that you're actually using on an ongoing basis to figure out who's at the highest risk right now, because I'm sure that we would all agree that the ongoing identification is where the work either gets stronger or where it breaks down over time, right? Because of the dynamics associated with social networks, folks hopping from a group to another, groups becoming part of other groups, just all of those things. So talk to us about the signals or the data that you're actually tracking around who's at the highest risk and how you use those to make the best close to real-time decisions around support and activations. Yeah.
Shantay, thank you so much. And I gotta take a deep breath because it could be a challenge. Because oftentimes we may, as we commit to a system, may miss some individuals that we should have engaged as well. For us, via our group audit, all of our partners are responsible for really analyzing recent arrests, analyzing social media activation, self-identification of a group member as well. And from then on, the Philadelphia Police Department, who really acts as our intelligence bureau for us within the city of Philadelphia, is then able to kind of submerge and put all that information within one particular pot that then we're then able to kind of pull from as well. So for us, we really are going to be looking at some of those individuals who may have been recently victimized and or potential perpetrator or have been known to be a perpetrator of violent crime. We're going to look at individuals who have picked up 3 to 5 VUFA, which is illegal possession of a firearm throughout the city of Philadelphia as well. And then we're also big, as I mentioned, just the landscape of Philadelphia has changed. Music has played a large role in a lot of retaliation, a lot of group mergers, and a lot of shooting incidents that we've had within the city of Philadelphia as well. So as we really kind of look at like a Excel sheet, right? One column is going to be past arrest. One column is going to be group identification or association. One column is going to be last contact with law enforcement. Another column is going to be based upon one social media handle and what are they posting as well. And as we're able to kind of get all of that information, we then have a large conversation to really tap in with our district captains, with our outreach workers, who are the individuals on this particular diaphragm that we may have that we wish to really put a lot of intention attention behind and allocate our resources to as well. As one continue to check those boxes of additional risk factors, that is when it is imperative for us to make our mark, make our move. But I think to our advantage within the city of Philadelphia, we've been able to kind of expand our pool of individuals that we wish to service, because I'm thankful that our governing body have made an amazing investment, not just within our OVP here within the city of Philadelphia, but also within a lot of our programs. So not only do we have a group violence program, we also have street out workers. We also have a workforce program that derives from Ready Chicago. We also have a probation-based program. So we're able to really kind of expand our pool a little bit more because of the resources that we have. So not only will individual, that person that we may identify may not fit what GVI offers, but they may fit what CCIP, which is our street artworks team, it may fit that particular project, that particular initiative. Or we may have someone who is a bit more susceptible to change, more susceptible to resources and services. They can then jump into the Ready Chicago model as well. So when we're having these conversations with our partners, we're then able to like, okay, this person may not fit GVI, which is a strategy that we really utilize for our high risk group members. It may not fit our GVI, but it may fit our CCIP. It may fit our PP3, or we may have an individual just pick up a case. We can make a referral to the court, say, hey, you know what? This person doesn't fit some of our programs, but we do believe that this person needs some extra attention. So we can make a recommendation to the courts for that person to be placed on a specialized probation system, which is our VPP, Violence Prevention Partnership. So we're thankful, Shantay, to have these robust initiatives, robust strategies that allow us to kind of do a little picking and choosing as to what program best fits. And that's is an advantage that we've had in Philadelphia, something that we didn't have in the past. Like we would just use or commit to one strategy, but today we're able to kind of commit to a culmination of strategies that allow us to kind of increase our pool of resources. Hopefully that answers your question.
It does. It does. I appreciate you sharing with the audience, you all being able to pivot folks based on what you've determined their risk level to be, instead of trying to, figure out a one size fits all strategy. Holly, I want to come to you. I am going to ask you to try to be comprehensively concise, and you too, Deion, in the questions going forward, so that we've got some time for audience questions, because those are pouring in and we've got a few more slides to go. But Holly, talk to us about like the signals or data that you're using on an ongoing basis to make sure that you're getting to the highest risk people right now.
Sure. I'll echo everything Deion said and be concise. You all are hearing us talk about the systems processes that need to be in place: shooting review, conflict mapping. We have an intake and assessment form that asks 4 questions. I'd be happy to share that with everyone. But those 4 questions keep us all accountable to making sure that we're serving highest risk. But the one thing I think that I haven't talked about yet is probably most important to this conversation about community violence intervention, which is the relationships that our staff build in community, keeps our ear to the street. And this is a little bit counterintuitive for government sometimes, but you have to trust the street. And so what I mean by that is that a lot of our referrals are friend referrals. They come from our clients and our participants. So our participants come in the door, they begin to build very trusting relationships with our staff. They understand what the program is all about. They trust us that we're there to help them, that we're offering resources, that we're life coaching them, and just really acting as a family. I know that that's also counterintuitive, because they say don't run your team like a family, but we do, because we know it's needed. And we want to make sure that our clients and participants don't just have a relationship with their one life coach, their one case manager, but really they have a relationship with the Department of Violence Prevention as aunties, uncles, sisters, replacing all of the social networks that we know that most oftentimes they don't have. And so those relationships, what will end up happening in real time practice is that they will reach out to their life coach and say, do y'all want so-and-so? And we have not even mentioned so-and-so, but we have been thinking about so-and-so. And, the client will be like, do you want me to put you in touch with so-and-so? Because I feel like so-and-so needs this program. And so we get a lot of friend referrals. And often have to explain the percentage of clients that we have enrolled during our quarterly mayor's review, because we have a performance metric that says 70% of our clients enrolled in program should be coming from the focused deterrence partnership table, right, meaning they should be referrals straight from shooting review, names that have come up. But because of the way that our relationship model is going, we don't meet that metric. And I don't have a problem explaining why we're not meeting that metric, because a large percentage of our referrals are coming from clients themselves.
It's so interesting that you bring that up, right? It's an interesting problem to have, because if we think about violence reduction as a continuum, we absolutely know that our communities are not thinking, hey, I'm the highest risk individual, and so that's why these services are being targeted to me, when they're thinking about their brother or their cousin and saying, oh, let me make a referral for this person too, even though they're at risk. So definitely an interesting problem to have, and I think worth another webinar or another discussion, right, around that work. David, want to come to you, though, given what we just heard from Holly and Deion, because it's good to understand the problem historically, but violence is really dynamic. It's always shifting. And so we need to know what risk levels look like right now and not 6 months ago, right? So can you walk us through what real-time identification looks like in practice?
Yeah, a couple of things. Thank you, Shantay. One is each of these on this slide could be its own webinar, let alone its own, right? But I'm going to be comprehensive and concise. So conflict mapping, which could be named, called a number of things, is really what Chief Joshi was mentioning around the staff having established relationships, connections in community, those violence interrupters, those outreach workers, those life coaches, and they're aware of what's happening in community. And so that sometimes, though, it's not as structured as it is in Oakland or Philadelphia and many other cities. And so the conflict map is about structuring this conversation. Okay, what do we know about the hottest conflicts in the city? What do we know about the incidents connected to those conflicts? What do we know about the people connected to those incidents? And which of these people have the most likelihood to either retaliate or be a part of a retaliatory cycle as victim or shooter? And what do we know about them, and who are we focusing on in order to connect? One of Chief Joshi's staff told me just the other day that he's got a person on his caseload that he gives like, $25 to $50 to every person in his crew he brings in. And he's like, hey, we're getting some great people in, and that young man's making some money. Right. And so it's a great little strategy within the strategy. So, right. So that's kind of conflict mapping. Again, the few seconds version, we have a couple of hour version. Shooting reviews, which are really significant, but have been talked about a bit by Chief Joshi and Deion. So I won't harp on them, but the idea is to look at the last 7 days of most recent shootings, not for who we're going to arrest, who done it or that. Which of these incidents have a likelihood of retaliation? And based upon the intelligence, the information that we know, the social media chatter, where they occurred, who they were against or by, and what's the plan to get in front of that retaliation? What intervention efforts need to happen to stop that retaliatory cycle? And just as a quick answer to, I think it was Liz's question around looking at victimless shootings, if you have the time in shooting reviews, you really should look at shots fired incidents, because if you know who the target was or where it was, that also could give you a lot of good information on looking at those shooting reviews. On HVIPs, the hospital violence intervention programs, these are people, one of the greatest risk factors that show you that you will be shot is that you have been shot. And so being in the hospital with a gunshot wound is a good way to identify individuals, as well as a moment when they are sometimes more open to intervention than other times. So it is a great post identifier, as well as a location to engage with participants. And then obviously the shooting scene response. When you have violence interrupters responding to shooting scenes, you're gathering intelligence, you're connecting with family individuals. Sometimes you're on the scene, you're hearing the boys plotting retaliation on the scene, right? So being able to really in real time collect information and understand, again, this retaliatory cycle. And the quick summary here is on this entire discussion, really, but on this real time is if you want to stop gun violence now, you have to engage with those who are involved in gun violence now. Right. So we're talking about right now, who are the people who are plotting, who are driving around looking for their ops tonight, right? And that is a little different than the young person who, if we don't have good intervention with them in the next 10 years, will hide at this risk. That is good work that needs to happen, but this is around right here, right now.
Thanks for that, David. You know what I was waiting for you to say, though, right? Because we talked about why risk matters, the identification of the folks. Let's hit the next slide, Mikaela, if you don't mind. Like service delivery is where all of this either lands or it's going to fall apart. And we always talk about making sure that we approach the work with the right level of intensity and specificity. I was waiting for those two words, right? Intensity and specificity, because a lot of times there's a disconnect between who's most at risk and who's actually receiving the services. But I think your points landed well there. I'm going to, just for the sake of time, I'm going to just punt the next question to one of the two of you, and then our last question before we open it up to the audience to the other. So to Holly and Deion, and whoever takes this first, we'll lead in with that person. What have you done to make sure that your service delivery is actually aligned with your highest risk population? And then we'll leave the last question for whoever doesn't volunteer or get voluntold to answer this question.
I'll go for it. I'll definitely go for it. I know for us, Shantay, within Philadelphia, I'll say one of the most important lessons that we've learned is that people who are at the highest risk are often least likely to kind of accept some or volunteer some other services in which we're offering. And again, most of them are dealing with trauma, housing instability, unemployment, family obligations, and also I'll tell you what we really have seen is concerns regarding their safety. I have a lot of my guys who are unable to leave their community, unable to leave their block. They let me know that if they do accept my offer of help, these are my restrictions. Like these are the areas that I cannot enter because I'm pretty sure something bad is going to kind of take place as well. And because of all of those experiences and barriers, we often don't really rely on individuals to come to us. And instead, we really use a proactive outreach model that allows us to really kind of build that rapport, that trust, and to really meet people where they are. My mission in the city of Philadelphia is really big on just doing my due diligence to kind of keep young people safe, alive, and out of prison, right? Like, how can I help extend your life expectancy to keep you alive each and every single day? So I'm going to really meet you where you are to ensure that you're safe and alive and out of prison. So what our outreach workers, they spend a lot of time developing those relationships, addressing some immediate needs before that full engagement for the long-term service approach. And I think a perfect example, man, there has been situations where an individual initially rejected, every offer of help. But after weeks and months of consistent outreach, I'm showing those individuals that we were here, that we were present. They eventually reached out when they were ready for help. In other cases, addressing practical needs such as obtaining, I-9 documentation, secure transportation, or connecting someone to emergency housing. That was like the first step towards a deeper engagement as well, because sometimes those guys may test you to see if, okay, I'm a ask for this to kind of see how far they can get, or if you're even willing to adhere to your requests as well, right? Like you have to prove to them that you really mean what you say as well. And these experiences has shown us that effective service delivery for those at the highest risk within our population, it requires patience, persistence, and a commitment to really building that rapport and building that trust over time.
Yeah. Thank you for that. Holly, while we don't have time to come back to you, I'm gonna officially request of David that we figure out what another webinar looks like to specifically talk about programs and talk about service delivery as it relates to the incorporation of risk factors. Mikaela, let's come to you though, to talk about what we know from a research perspective and what we're seeing jurisdictions do to build risk into their intake and service models.
Yeah, absolutely. Thanks, Shantay.
Yeah, let's hit next slide, please.
We'll go very fast. But just, we talked a lot about how do you identify people who are at risk. And so then part of the next task is once you know the characteristics of people who are at risk, you also want to make sure that that is who it is that you are serving, who it is that you're working with. And so two really critical ways of doing that. One is just using a set of questions based on those characteristics as a screening tool for putting people into your programs and services for very high risk individuals. And as Deion and Holly have said, someone who does not meet these criteria, it doesn't mean that there are no services available to them or that there's no support that they may need, but it is to say that the services that are specifically focused on immediate gun violence prevention, reduction, and intervention for highest risk individuals should have criteria that are tied to risk factors. Yeah. And then the second part is more of an ongoing process of reviewing who it is that you're serving on an ongoing basis to make sure that the people being served through those intervention programs are reflective of the risk characteristics that were identified through the real-time identification processes, through the problem analyses, and through the kind of extensive body of both research and practice that has shown us so much about who actually is at very high risk for involvement in shootings and how can that information drive prevention and intervention and reductions in violence in the short term.
Yeah, thanks for driving home the point, Mikaela, that this can't be a one-time exercise, right? That literally if your client population doesn't reflect your highest risk population at any given moment, that something's off, right? That you're not servicing who you need to. Holly, forgive me, we are not going to be able to ask the last question and still honor our commitment to be able to address audience questions, just given so many that we had. But I will say thank you to you all. I feel like this was a really good conversation. And before we jump into questions, if I had to leave us with anything, I think it would be simply that we know we aren't going to be able to reduce violence by doing more. We have to reduce violence by doing the right things with the right people at the right time, right? So this isn't a volume thing. This comes back to intensity and specificity. Like who are we actually looking to work with, and the risk factors associated with those folks. So let's open it up to questions. Gonna ask my fellow panelists if you see something in the list of questions that feels like we should address it, given that we've got 13 minutes and I don't see it because there are a decent amount of questions in the Q&A. Feel free to scream. But I'm gonna start with the first one here. And I'm gonna turn this over to David, Mikaela, and Vaughn, if I could. So just have one of you kind of address this. How does this risk assessment, identification, and service delivery translate into rural communities?
And I'll be very quick, Mikaela, because we just did a statewide or a large part of the state of Washington analysis around this. And while it looked very different in some places, some of the populations and some of the risk factors were different, the processes are the same. Is right, really review what shootings have occurred in the last 2 years and who were involved in those shootings and what are their risk factors, right? And those risk factors and demographics in particular might look very different, but the process really is the same. And have a regular review of shootings. Your volume might say you might not need it every week, you might need it every other week, but again, the processes are pretty similar. What you get out of the processes might be very different.
Thank you for that, David. I'm going to turn this next question over to Vaughn, if I could. And feel free to add on to what David said in answering this next question if you want to, Vaughn, because it touches on something that you, Mikaela, and I went back and forth on as we were co-writing this report, right? Can you speak to the city size of the research that's been conducted? Is it true? Is it also true for mid-sized cities such as roughly 300,000 population? Right? We've got a section in the report that actually talks about some of the cities we did this work with.
Yeah, no, I think it's a great question. And I think there is a connection to David's response to, and I just add to that, haven't done a ton of work in rural areas, but have done a little bit. And I think everything he said, I agree with. I think these tools will still apply. I think the concentration of risk is still going to hold. I think you may find more intimate partner violence relative to group and network violence. But I think that there are still, tools and approaches and treatment supports and justice system capacity building work to do. But first, understand the population at risk, and I think work from that is the same basic idea. And then Shantay, to the question you're posing, I mean, again, I think it's always important to go into any community with your eyes open and to kind of have a neutral approach and work from the facts that you find. But over 30 years and 100 cities that have done problem analyses, pictures
Your signal, we're losing you, Vaughn. You keep going in and out.
very consistent. It is super concentrated, older adults, justice involved, connected to high-risk networks, with a large share having been previously violently injured. And so, again, can be open to your community looking different, but expect
We did catch the tail
it has
end.
not been a great internet day.
Yeah,
I'm trying again.
We did catch the tail.
Can you hear me?
Yep.
I
Yeah.
think we,
So I think the principles will hold is the shortest version of my answer. I think the principles we talked about and the concentrations we're sharing are very likely to be what you will find in your community if you use these tools.
thank you for that. Isabel, we already answered Liz's question in Philadelphia. David answered that during the conversation. This may be for our panelists. So Holly, I'm going to turn this question over to you. Thinking about how to use data to garner support for CDI, have you measured and reported those who are at risk for experiencing violence in your geographic area? If so, what were the responses to that kind of data? So we know that we've measured it, right? We talked about it being 0.25% to 0.5% typically. What were the responses? Like what should folks anticipate will be the responses associated with that?
Yeah, thank you for that question. This to me, really speaks about one of the questions that we had planned but didn't get to, which is around political implications of trying to do this work in your
Yes.
city. In particular, if your city has always had, like most cities, an over-reliance on traditional law enforcement or punitive responses, and now you're introducing CVI work into government. I mean, we know that CVI work has been happening on the ground in cities across America for decades out of the community-based organizational field. But when we're talking about now really trying to integrate it into like a mayor's public safety priority or the city administrator's priorities, it's a different conversation. Overall, I would say the number one strategy that us as leaders in the field need to really understand is our identity as advocates, activists, and organizers. Like, this is a change strategy. This is narrative change work. This is change work. And so really understanding how social change has been successful over time in other movements is really important. And, relatedly, David and NICJR brought me into the VRMI Management Institute to teach a class specifically on change strategies, understanding how change works. And there are change steps that activists in the civil rights movement, women's rights movements, like, we've learned what works over time. And so I would say that's first and foremost, is us realizing and understanding that, yes, we're practitioners and we're operational and we have to know this, all of this. And we have to be communicators who really understand that our number one identity as the leaders is to identify as activists. Now, as far as the specific question around how people take it is varied, is very much varied. Some sometimes people have a very negative reaction to me telling them that I need 150 people, but like that's real. When you break it down, it's still less of an investment that we make to house people in prison for a year. It's much less of an investment than one person being shot. As you all know, and as NICJR has done the data in Oakland, it's like $3 million per homicide or more, right? So it's again challenging the narrative and the ways in which people think about investments, think the population that we're trying to serve. This is an equity issue as well. So if you have a really we're the home of the Black Panther Party, so all we do is talk about equity. So I get to use that, right? Like, listen, this is an equity issue. We're talking about the people that are most at risk and most vulnerable to violence, and now we have a way to identify those individuals, and we have an obligation and a responsibility to them as a city that's focused on equity. So there's various degrees of response, but I think the permission to focus is what we're trying to gain. You don't need permission from the whole city. You really need a small coalition of people that have power to get behind it. And then you move together. And that's what I think is most important.
Thank you for that, Holly. Mikaela, I'm going to turn last question over to you. And then David, I'm going to turn last comments over to you. So Mikaela, the session began by discussing how public health could use two lenses for violence reduction: the identification of high-risk individuals with your COVID example, as we're talking about here, but also thinking about violence as a result of social determinant of health conditions. Are there any models focusing on how to change social determinant of health community conditions in order to reduce violence, right? I think that this speaks to our violence reduction continuum in a whole host of ways. Sign me up for all of the other webinars that we'll be doing. But let's get your response there, and then David, we'll let you have last word.
Sure, thanks, Shantay. I have a couple responses to that. So I think, first, when we are thinking about violence reduction and violence intervention, it's really important to define the goals before we define the strategy. And the goal that we are talking about here today is short-term, immediate reductions in violence. And so none of that work is to dismiss the structural conditions that give rise to violence, but it is to recognize that addressing the structural conditions that give rise to violence is a long-term intervention that will take years, decades, and generations to really manifest and show effect. And so given that our goal now is to reduce violence right now, the focus really is on that high-risk population and those specific individuals, and not on the structural determinants and structural conditions of health. With that said, I think it's really important also to acknowledge that violence is itself a structural determinant of health. And so if and when we are able to reduce violence in the immediate and in the short term, we actually better the lives, the health, the well-being of all of the people living in the communities where violence happens. And there's a cyclical and multiplicative effect where we actually are addressing social determinants of health by reducing violence. So I think that's my response to that question.
Thanks so much. David, when you're ready.
Mikaela, I'm sorry. I know we're running
Please.
on fumes now, you guys, but I just want to really say I think that you're absolutely right. And just based on my last response, the work of embedding CVI into government is in of itself a structural intervention. I mean, I think we should all really realize that we're not going to fix all of the historic issues through CVI, but the introduction of CVI into government and all of the CVI workers that come along with that, right? Like in my city, in Deion's city, we have city staffers that are credible messengers who would have never been hired, right? And so I think just adding that both and to the conversation.
Yeah, and I think that's a great segue to just close. I mean, just to think about Holly's point. Deion is a deputy director in a major agency, is largely the face of violence reduction in the city of Philadelphia. He makes no qualms to say he's formerly incarcerated, right? Chief Joshi's deputy who runs their direct service practice, who has a master's and a bachelor's from UC Berkeley, also spent many years incarcerated. The director of the city of Richmond, California's Office of Neighborhood Safety, right, spent nearly 10 years in San Quentin. This is transformative, right? So these are not just leaders of community violence intervention, government directors, right? Government officials. And so that's huge. And to that point, I think it is just awesome to have had this discussion. Really want to thank all of our partners. Shantay, thank you for facilitating a great discussion. Chief Joshi, Deion, Vaughn, thank you all. Thank you, Mikaela, for this wonderful discussion. The incredible questions and comments. We could have spent an hour just on the comments and questions from those, and many of you all who are doing this work as well. So I just want to say thank you all. You have the report. This conversation will continue. As Shantay say, we'll have to have another webinar soon to continue the discussion. Thank you all and have a wonderful day.
Thank you, everyone.